Welcome to our webinar on COVID-19 success stories, lessons learned from the US and Korean Peninsula. We are thrilled to be partnering with the Korea Consulate for this program. In just a moment, we'll hear from the Korea Consul General, Yoon Sang-Soo. We have a wonderful audience today, including representatives from the Korea Consulate, our board members, groundbreaker members, and innovators. Since shelter in place, our team has hosted nearly 200 speakers virtually, and those speakers have come from 17 different countries and regions. And now that California has opened up, we're preparing to host events in person. We'll also continue to host events virtually so we can keep growing our global audience, and that includes you. So thank you for staying with us, and we look forward to seeing you in person soon. We'll have an hour for this program today. We'll finish at 6 p.m. Pacific, that's 10 a.m. in Seoul. I'm Margaret Conley, the Executive Director of our Northern California Center. And our format for today, we'll hear a few words first from Consul General Yoon, then I'll introduce our moderator, Paul Choi. He'll introduce our speakers, they'll have a moderated discussion, and then open it up to audience Q&A. So if you have a question for any of our speakers, type them in the Q&A box at the bottom of your screen. Paul, our moderator, will be monitoring that box throughout the program. This event is on the record and we are recording. And now I'd like to introduce Consul General Yoon Sang-Soo. He has served as a diplomat for over 20 years and just recently moved to San Francisco in November. His jurisdiction here includes Northern California, Colorado, Utah, and Wyoming, where there are over 220,000 overseas Koreans. He was previously posted in Seoul, Korea, Australia, Malaysia, Greece, and Switzerland. He also had positions in the Ministry of Foreign Affairs in Korea. He has degrees in law from Seoul National University and Georgetown Law School in Washington, D.C. Consul General Yoon, thank you for this event and welcome to San Francisco.
Good afternoon, distinguished guests, ladies and gentlemen. It is my great pleasure to make remarks on the occasion of a webinar titled COVID-19 Success Stories, Lessons Learned from the US and Korean Peninsula. First of all, I would like to express my sincere gratitude to Asian Society Northern California for organizing today's important event. And I also appreciate the prominent panelist and moderator today, Dr. Yoon Kim, the clinical instructor, Stanford University School of Medicine, and Dr. Alice Hyun-Kyung Dan, internist and the international healthcare consultant with Medi Women's Hospital, Dr. James Lawler, the special advisor for health, the Asia Group, and the moderator, Paul Choi, head of research, Korea CLSA, for joining today's event. When the Korean President Moon visited Washington, D.C. last month, the Republic of Korea and the U.S. government agreed to establish a comprehensive Chorus global vaccine partnership, strengthen joint response capability for infectious disease through international vaccine cooperation. This partnership was built based on each other's strengths. That is, Korea has a competitive edge in manufacturing, and the US has a strength in new technology and innovation. If the two countries work hard to expand the manufacturing of vaccines that have been assessed safe and effective, the end of the pandemic will be very soon. This shows that the two countries are already working very closely in response to the COVID-19 pandemic, and the Korea-US Air Alliance is playing a very important role for the benefit of a global population. Taking this opportunity, it is very much imperative for both countries to build better pandemic preparedness, help the Indo-Pacific region build the capacity to prevent and detect and respond to the infectious disease outbreak in the future. Against this background, I strongly believe that today's webinar could be timely and very much useful because discussion today can give some guideline for two countries to cooperate in response to the pandemic. It would be much greater if the panelists can present directions for cooperation in this regard. Once again, I truly hope that today's webinar can provide opportunities for our countries to seek ways to prepare and cooperate with each other in response to the next pandemic. Thank you very much, and I hope that you will enjoy very nice discussion in the webinar today. Thank you very much. Thank you.
Thank you very much, Consul General Yoon. Yes, we're very much looking forward to this discussion. And to get us started, let's introduce our moderator, Paul Choi. Paul is the head of research in Korea at investment bank CLSA. He's joining us from Seoul. Before that, he was an investment manager running Asia equity strategies at Lazard Asset Management. He has managed equity hedge funds at Shinhan BNP Paribas Asset Management, Corvest Capital Management, and Tiedemann Global Emerging Markets. He has degrees from the Sloan School at MIT and Yonsei University in Seoul. Paul, thank you very much for moderating today. It's all yours.
Thank you, Margaret. Hello, everyone. I think the title is very interesting because Korea is a country that's held as a model early on for successfully flattening the curve in containing the virus without a full lockdown. And US is obviously leading the charge in vaccination globally right now. For the discussion on the lessons learned, we invited 3 panelists. Let me just introduce one by one. Dr. Yoon Kim is a clinical instructor in primary care and population health at Stanford University School of Medicine, and an epidemiologist in outbreak management, Central COVID-19 Command at the San Francisco Department of Public Health. After growing up in the US, Korea, and France, she trained at Brown University, the Santa Clara Valley Medical Center, and at University of California, San Francisco. Her areas of expertise includes population health and the built environment, the medical humanities, and tolerance for ambiguity, the inpatient narrative oncology. And Dr. James Lawler is a special advisor for health at the Asia Group, is an infectious disease physician trained in tropical medicine and public health, whose career has focused on emerging infectious diseases, pandemic threats, and health system and public health preparedness. Dr. Lawler currently serves as Executive Director for International Programs and Innovation for the Global Center for Health Security, as well as Deputy Medical Director for the Nebraska Biocontainment Unit at the University of Nebraska Medical Center. Before joining that team in November 2017, he served 21 years in the US Navy Medical Corps. Third, Dr. Alice Hyungyong-tan is internist and international healthcare consultant at Mismedi Women's Hospital in Seoul. Prior to joining Mismedi, she worked as a clinical associate professor at Samsung Medical Center from 2014 to 2018, providing primary care services to foreign heads of state and heads of mission. As a reaction to negative personal experiences during MERS outbreak and the Sewol ferry tragedy in Korea, Dr. Tan has been committed to educating and informing the English-speaking community openly about COVID-19. Since the beginning of the pandemic, she has given more than 150 radio, television, podcast interviews in the US, UK, South Korea, China, and Australia. She posted frequently on Facebook updates and presented at the Fulbright Scholars Lecture Series and Civil Service Exchange Program between the US and Republic of Korea. That's our panelists. First, I want to start by asking our panelists about the early part of the COVID-19 outbreak, how the government has responded. So what are the lessons that we can take away from those efforts in containing the virus? What has worked well? What has not been worked so well? And what should have been done that has not been done? So I'll open up. Let's go to Dr. Kim first, and each panelist will have a chance to speak on that topic.
Thank you so much. I think reflecting on what worked well, I work in outbreak management in San Francisco, and my first introduction was in November of 2020. So that was pretty late into the pandemic. But what we noticed is that other countries were doing a much better job early on, such as Korea. And I'll let Dr. Tan talk about that. But we need to learn from better case investigation and contact tracing. What we did well in the States is We recognized pretty early on that the disparities were pretty significant. For example, in the US, as you know, it's a multi-ethnic population. I think Koreans only make up about 0.8% of the entire US population, but in California, there's about 8% as Korean. Of the disparities, we see that certain people who got vaccinations first and who got COVID and who died in the hospital, it depended a lot on what kind of background they came from, what kind of income they had, what kind of education level they had. So recognizing those disparities, at least in San Francisco, they were trying to make access to care and to vaccinations as equitable as possible kind of early on. We're also very lucky that in Northern California, masking was not considered a political thing in general, that people were very on board with masking. So I think perhaps early on, the lessons that we had to learn was to move quickly, to pivot quickly. At Stanford, they actually were very quick in terms of moving very quickly towards developing testing. And so I think one of the first assays to pick up COVID as a PCR was actually developed in the Stanford labs, and they freely shared this with many other institutions. And so it was the first time I've seen in my 25 years where everybody dropped everything and then moved quickly towards a common cause, but it took a little while to get up to speed.
Okay, thank you. Dr. Tan, what was your take on the Korea's response?
Well, on an organism basis, immunological memory, that's the concept behind what makes vaccines work. On a national basis, I think that translates to basically learning from past experiences and implementing them for COVID-19. And that's kind of what led to our relative success, especially early on. So for the H1N1 pandemic, Korea learned that having an effective vaccine was going to be the way out, and also that domestic vaccine production would be very important, and having a national immunization program that works was also going to be important. So that was a learning lesson from H1N1. From the MERS pandemic, we learned that having a very opaque method of dealing with infectious disease outbreak was not the way to go, that it was counterproductive. We also learned that using technology such as CCTV data, credit card transaction information, mobile phone data, that these were all tools that could be used to help with contact tracing and isolation. And then from the Sewol ferry tragedy, we learned that a very rapid and bold government response was the right way to respond to a national crisis. And so based on these prior, I would say, not so good experiences for COVID-19, the Korean government took an approach that was timely, that was transparent. It was a total or all of government approach. We used, of course, the traditional epidemiological, non-pharmaceutical interventions and contact tracing, all of these measures that have been in place for decades. Korea used, but with a precautionary approach. In other words, we tried to implement them early on before we had, what we call A-grade data, scientific data to support what we were doing. And then also we used technology from the very beginning and throughout our response to the pandemic. And I think these are all sort of aspects of our approach that really helped shape the trajectory of COVID-19 in Korea. In terms of what could we have done better, I think when we saw the pictures coming out of Wuhan, we should have prepared surge capacity sooner. There was a time after we got our first huge outbreak, the Shincheonji church outbreak, when we got that under control, there was a time when we were lulled into thinking that perhaps the pandemic was over. And we did not use that period to have surge capacity, especially ICU beds, negative pressure isolation beds. And that turned out to be a very painful mistake when we had our big winter surge, because we were scrambling for beds, and there were some people who had to wait, and their care was delayed because a ICU bed was not available. Otherwise, I think Korea also could have invested a little bit more in terms of domestic vaccine development. I think what we need to learn from the United States is how did Operation Warp Speed work? We do have 5 domestic vaccines in late stage phase 3 trials right now. But I think we need to learn how could we speed up the process the next time we have an emerging pathogen of pandemic potential. But overall, I think if we look at the numbers where we're at right now, in terms of total cases per 100,000 population, total deaths per 100,000 population, I was doing the math, and we're about, I think, 3% of the total number of cases of the United States, and a little less than 2% of the deaths. And so overall, I think we have had a successful, relatively successful way of managing COVID-19. But success is relative. There has been a lot of tragedy that could have been prevented even in Korea.
Thank you. Dr. Lawler, do you have anything to add on that?
Well, I can honestly say that listening to Dr. Tan describe all of the amazing things that Korea did and how well they have managed the pandemic, really from very early on, made me incredibly sad. Because in the US, we did almost exactly the opposite of every one of those things, unfortunately. And it's hard to find much more striking contrast between two countries' management of the pandemic than ours and Korea's, unfortunately. I think people really have just a very short memory and a very unrealistic perspective on what could have happened in the US. I think that the numbers tell the entire story. If you look at deaths per million from COVID-19 in South Korea, and you applied that to the US, so the US, by the way, made a lot of news recently because we just surpassed 600,000 COVID deaths, right? And that's almost certainly a dramatic underestimate. I think most epidemiologists would estimate over 900,000 and probably a million deaths in the US to date. If we had the same deaths per million rate as South Korea, we would have had fewer than 13,000 Americans die during this pandemic. If you let that sink in, that tells you how poorly we did as a country. It is quite honestly embarrassing. The one success we have had is in vaccine development and rollout. That has been remarkable and has been, I think, something that will be a lasting legacy. But I think the lesson is also we can't rely on vaccines to get us out of future pandemic threats, right? It took us a year. And at that point, our trajectory of losing at least 500,000 Americans was pretty much already set. And so if we had been dealing with a virus that had a case fatality rate of 1% rather than 0.5%, imagine the devastation. We took our health system to the brink and beyond in some places. Imagine if it was twice as bad, which on the grand scale of pandemics that we've planned for, a 1% case fatality rate is really not that extreme. And so as horrible as this has been, we were lucky right? We didn't get hit with the worst virus we could have by any stretch. And so that's a lesson that we really need to take to heart moving forward. I hope we do. I'm not optimistic that we will, to be quite honest.
Thank you for that. When in the early part of the pandemic, when I told my U.S. colleagues about what's the Korean government doing to like contact tracing and to contain the virus, they mentioned that something that Korea is doing in our country is probably not even possible in the U.S. because it's a breach of the privacy. So I think the difference between the U.S. and Korea's response to coronavirus has a lot to do with either cultural or society or some legal implication, the differences between the two countries. Do you have any, what is the real cause of the differences, and what is the implication for the next pandemic that may come?
Could I take that question? Sure. I'll take a stab at it. Yeah, I totally agree with Dr. Stan and Lawler. I think that we know from Korea's example, just the ones that everyone knows about, of course, the CCTV, tracing people through their credit cards, their mobile phone records, and also, so the technology is very different, and the use of that data is very different. Like in the US, it would be very difficult to get permission, and people will probably be very leery about sharing that information or being traced by that. Also, the fact that you were prepared prior because of the MERS and SARS epidemics, you had sort of a centrally coordinated and then locally by neighborhood almost tailored response. We don't have we certainly lack universal health care, and I think that's a huge part of it. But even the coordination, I think that still is clearly it's lacking. And then the third thing that you have that we didn't have, in my opinion, is public buy-in, that trust. And that really comes from being transparent and not having learned from prior times that when the government asks you to do something and they provide the reasons why, in general, it seemed as though the Korean public, there was buy-in. Like people would, be okay with going to the pharmacy to get their, quota of masks every 2 days, or they would line up to get their swabs done. It wasn't as though it was some sort of a stigma to find out if you were positive or not. And so that was very different. And those are really great examples of how Korea and to me, their quick response. Also, just getting prepared in terms of just, manufacturing, doing a complete 180 and manufacturing, I think it was testing kits right away. As soon as you had that was amazing. And that took a lot of Korean sort of do it fast, break it fast, and then get it right, so I think that was something to learn from Korea. And sometimes in the States, I feel like we try to get everything perfect before we actually roll things out. And then in terms of why over 600,000 people died, and I totally agree that if you look at the indirect effects or indirect deaths of COVID, like the people who delayed their care, who didn't go to the ER, had their MIs at home, or having trouble getting to the hospital right now for fear or other reasons. As I mentioned, the US is a very heterogeneous, perhaps more heterogeneous than Korean population. And there's a long history of disparities. Most of my work is with vulnerable populations or people who don't have a lot of access to care. And so we see that, where you live, like the zip code you live in, or whether you graduated from high school, or how much income there is in the neighborhood even matters more than your individual income. Those things actually matter more to health even than how good of a doctor I am. So 90% of premature mortality in the US happens because of these environmental or structural barriers, not because of the kind of medical care that you're getting. And so until we take time to realize that this is our opportunity, when we learn to actually change those structural barriers by doing things like, getting involved with, decisions like policy decisions, writing op-eds for my medical students. I tell them there are safer ways to protest. You can vote, things like that. That can make a big difference. But until we recognize that we actually have to take care of the neighborhood and all boats have to rise, not just the US's boat has to rise, I think we're going to be in the same situation if we don't learn from these opportunities.
Thank you. Dr. Lawler, anything you want to add, disagree, agree?
No, I think that's I think that's right. Certainly, there are some parts of South Korea's response that would be very difficult to replicate in the U.S., but the vast majority of it was just good public health, right? It was being prepared. It was making investments beforehand. It was getting testing out quickly, and it was doing good public health practice. And those are things that we could have done and we could all do. And so I really commend the job that Korea did. They have been an exemplar in how to manage the pandemic well, without shutting down your economy. That's the other thing that I think we've had this idea in the US that it's a dichotomous choice of you're either locked down or you're fully open. And the reality is you can implement these non-pharmaceutical interventions with much more surgical precision, which is, I think, one of the things that South Korea did really well. And you can have the benefits without having the extreme pain that we've subjected ourselves to. We've managed to get the worst of both worlds. We have subjected ourselves to the pain of full lockdowns often, and we have still managed to have a horrendous outcome in terms of cases and deaths. And again, a well-executed response would have allowed us to avoid both.
So thank you. I want to ask Dr. Tan about what do you think is it unique to Korea, what the Koreans have done to contain the virus and flatten the curve? Is it transportable to other countries, or is it something that you think was quite unique that can happen in not many other countries?
That's a really good question. I just wanted to say, first of all, that Korea, we have in our legislation, we have the Infectious Disease Prevention Act. And that was first written up, I think, in 2009. And after the MERS outbreak in 2015, it was revised. And this bit of law is what allowed for the massive contact tracing that really, I think, allowed for the isolation of all of the infectious cases, not all, but many of the infectious cases. And that was so critical to getting this respiratory pathogen under control. In terms of everything else, I completely agree with Dr. Lawler. I mean, as I said, a lot of this was traditional bread and butter epidemiology and non-pharmaceutical interventions that have been around for a century. So yes, every other country in the world, it doesn't matter what sort of technology you have, you can implement these measures. And I will just point out that in terms of our case fatality ratio, the biggest decrease in the case fatality ratio actually occurred prior to the rollout of vaccines. So in terms of a decrease in our case fatality ratio from March to June, after vaccines were rolled out, the decrease was much less than prior to when vaccines were rolled out, when we were using social distancing and public health measures and really emphasizing the importance of masking up and all of the routine hygiene, hand hygiene, distancing, ventilation measures. So those kinds of techniques, they can be used anywhere else in the world. I was actually in New Zealand when they went into lockdown. And I experienced firsthand what they did. And it made me wonder, sort of compare the two countries, New Zealand and South Korea, because South Korea, our 38th parallel to the north, our northern border, is a closed border. So effectively, even though we are a peninsula, we're an island, similar to New Zealand. And I wondered, had we closed our borders completely, shut all incoming travel except for repatriating citizens, sort of done the very hard lockdown that New Zealand had done, would we have had a better outcome? I'm not so sure about that, because as we were dealing sort of on a rolling basis with the pandemic, we were, I think, learning, how to deal with this on a daily basis without lockdown, how to pinpoint our measures, which kind of venues were the highest risk, and so what sort of curfews we needed to implement, what sort of capacity limits we needed to put in place. And so, perhaps we would have been a different situation had we taken an approach similar to New Zealand. But I think overall, in terms of learning how to deal with this type of highly infectious, highly transmissible respiratory pathogen, I think we learned some very, very good lessons that will prevent, a similar outbreak of this scale in the future. The other aspect is, vaccine manufacturing. So as I mentioned, we have 5 domestic vaccines that are in phase 3 trials currently. But we have a lot of vaccine manufacturing capacity. So we're making other companies' vaccines in Korea. And I think that's something that other countries can learn to do. And I think that's something that the EU has committed. They will help Africa, the African continent, do so they can manufacture their own vaccines. Because certainly, as we are all experiencing right now, even though we have vaccines at work, that's no longer a mystery, manufacturing to scale is proving very, very difficult, very challenging. And that is perhaps the biggest challenge of the moment, is getting vaccines manufactured to scale so that we can have the global equitable distribution that will finally put an end to the pandemic. And so I think getting other countries sort of on board with building up a biotech infrastructure so that vaccine manufacturing can take place, because actually making a vaccine de novo that works, that is going to take time. But having the technology to make at least, other companies' vaccines, contract manufacturing, I think that's something that other countries, I think that's a skill that we can spread to other countries.
Just on that topic, on the vaccines, how is the vaccine status in Korea, and when do you think that the country will reach herd mentality, or go back to fully normal because of the vaccination?
So as of yesterday, Korea is up to, I think, 820,000 vaccines per day. And we've vaccinated over 14 million Koreans with at least a first shot of COVID-19 vaccine. That's about 23% of the population. 5.8% of the population has been fully immunized. And of course, our vaccine rollout started February 26th. Our projection, our hope, is that during the third quarter, so that's July, August, September, we are contracted to receive 80 million doses, a combined 80 million doses of AstraZeneca, Pfizer, J&J, Novavax, and Moderna vaccines. And the goal is to vaccinate 36 million people by the end of September, and that will be 70% of the population. That's all adults 18 and older by the end of September. And of course, herd immunity is not a set number. You will kind of know that we've reached herd immunity once it happens. And it's based on a lot of different factors. South Korea, the Seoul metropolitan area, is one of the most densely populated places in the world. Culturally, Koreans like to do everything in groups, and that's actually not a good thing when it comes to a respiratory pathogen. But if we look at Israel, they, I think, have reached 63% of their population having been vaccinated, and they've seen remarkable control of COVID-19. And so hopefully by the end of September, if we do reach 70% of our adult population, we will be able to return to a more normal life. Of course, that leaves, all of the students, children less than 18, who we hope will be in school. But the measures that they've implemented through the Ministry of Education, they have actually worked quite well to protect students in schools. So many students are in school, not necessarily every day, of Monday through Friday, but most students are in school at least, I'd say, 2 to 3 days a week. And that's been the case for actually most of the pandemic, fortunately. I think once we have enough Pfizer vaccines to start to vaccinate the lower age groups, then that will really be a turning point in returning life to normal in Korea. And then another lesson that we learned is about masks. In Korea, unfortunately, so we're learning from a lot of bad experiences, but unfortunately, Korea sometimes has some of the worst air quality in the world. And so the wearing of masks is something that we've done actually for many, many years now. And come spring, every spring, everyone's looking at what the air quality index is and, whether or not I'm going to have to put a mask on my kid and let them play outside. I mean, that's something that we've been dealing with for a long time. And so hopefully we will build forward better and deal with the environmental issues as well. And so we will truly be able to be without a mask, not just because of COVID, but because of clean air too.
Sure. The audience are starting to ask questions. And audience, if you have any questions, you can just type it in and I will throw the questions to the panelists at appropriate time and appropriate topic. And staying with Dr. Pan, there's some questions asking about COVID experience in North Korea. If you know anything there, what's the intelligence? And then the other question is there any similarities or differences between the Korea experience and China experience?
In terms of North Korea, of course, there's not a lot of reliable information coming out of the country. However, my understanding is that they have accepted vaccine donations through COVAX. And from what was shown on mass media, from what was in their news in North Korea, there was a lot of concern about COVID-19 in their country. So much to the degree that there was an incident where I think he was a fisherman or a South Korean citizen was at sea and somehow crossed the international borders, maritime borders into North Korean territory. And North Koreans were so scared that the South Korean would be carrying COVID into their country that not only did they kill this person, but they burned his body at sea so that there would be no chance of the virus entering their country. Beyond that, I don't know. I don't have any reliable intel as to what's going on in North Korea, other than they have accepted vaccines, as they should, and we should all donate to North Korea as well. In terms of the response to China, of course, South Korea was the #2 country in the pandemic timeline to have a really big outbreak after China. And China took very, I would say, draconian measures to get their outbreak under control. A very big lockdown throughout the country. Transportation came to a standstill both domestically and internationally. Korea, I think we decided to take a divergent approach, more on trying to rally the public to follow our infectious disease recommendations, prevention recommendations, rather than sort of forcing very draconian measures on the public. And I think from the beginning, because it was, we were number 2, we didn't, we didn't have any other points of reference. We saw what happened in China, and I think Korea was almost determined to take a different approach because of a sort of a philosophy towards governance was different. It's hard to say, I think at this point who was better, because actually China's, they're living mask free. And in terms of cases, it's been much better controlled, we could say, than Korea. In terms of testing, I will say that after China saw the massive scale up in testing that happened in Korea, they decided to apply that same approach, but to a much higher degree. For example, I think there was maybe just a handful of cases that were discovered in one of their cities of 9 million people population. And they decided to kind of do a mini lockdown and test all 9 million people. And they did it, I think, within 10 days. And that was China style. That was quite incredible. And actually the Korean legislation, we looked at what China did and we wondered, should we do the same thing maybe? Should we start testing all of our citizens in sort of discrete, metropolitan zones? We never did it to that degree. We did try to take testing, anonymous testing to the streets through testing, sort of mobile testing centers in major metropolitan areas set up in subway, entrances. The approach was different from China, but I think it was deliberately different. It was intentionally different.
Right. So in terms of spectrum, there's China, Korea here, and the US sort of on the other side of the spectrum and dealing with the pandemic, I guess. Okay.
Way on the other side of the spectrum.
Sure. Anyway, so I want to go back to the vaccine. There are a lot of questions surrounding the vaccine here. First of all, let me just ask, what is the global prospect for vaccine access by the end of 2011 and beyond, globally? What's the situation?
I can stab at that first, I guess. Right now, the projections for vaccine manufacturing actually are impressive. I think they may overestimate what actual production capacity may be. But if you look at the projections that Pfizer is giving, for instance, they are forecasting almost 2.5 billion doses of Pfizer vaccine will be produced by the end of 2021. And I think that's remarkable, surpassing anything that anybody initially suspected, well above AZ's projection of about 2 billion, which was really supposed to be the workhorse of COVAX and the global vaccine program. I think that speaks to the revolutionary technology of mRNA vaccines, to be honest, and not only in terms of their efficacy, but as one of my friends and colleagues who is in the vaccine industry has, I think, very sagely put, it is transformative to turn biology into chemistry, right? Making vaccines, which are biological processes, are incredibly hard, incredibly unpredictable, and take a skill set and experience that take a long time to master, and they're always unpredictable. And just look at the issues that J&J has had, AZ has had. What mRNA vaccines have done has turned vaccine production into chemistry. It's just linking bases together, right, in a chemical synthetic reaction. And that becomes incredibly predictable and incredibly scalable once you crack the code. And so that is going to be, I think, something, again, that will be a legacy of this pandemic. The issue, to be quite honest, is not necessarily supply. The issue in the US hasn't been supply for a long time, honestly, since February. We have outstripped our demand with the supply that we've had. And it's been an execution problem. It's been a public messaging and perception problem. And that's going to be the issue on a global scale. We're going to have vaccine hesitancy in many parts of the world as bad as we've had in the US, as maybe hard as that is to believe, but I think that's the case. And the second thing is you have to be able to figure out how to get these vaccines the last mile into the arms of people, right? Getting it produced off the factory line and into a warehouse in the capital city or largest port city in a country is not the hard leg of this race. It's that last mile of getting it into the arms of folks. And there are going to be many low and middle income countries that struggle with logistics of a widespread vaccine campaign. And that's where we need to focus our efforts. To be honest, I think all of this talk about increasing vaccine manufacturing capacity in these countries is misplaced. You're not going to be able to do it in the short term. I think it's a great long-term goal and we should work on it. But again, making these vaccines is really hard. And to expect anywhere that's not, South Korea is an exception, right? South Korea has an incredible biotechnology base and has been developing that for decades. You can't move into a country that doesn't have that, and into factories and manufacturers that don't have that type of skill set and knowledge, and be able to make a safe and effective vaccine. What will happen is the opposite. We'll end up producing low quality vaccines that are dangerous and don't work, and will completely undermine the credibility of the global vaccine campaign. Again, supply is not the issue. We should be focusing our efforts on equity of distribution and then the last mile of distribution in those countries that need it.
Great. Dr. Kim, I'm going to ask you a similar question on the vaccine, but with a little twist. There's a question from the audience that the history of science and medicine is full of unintended consequences and side effects. So how concerned should we be about the potential side effect and the unintended consequences of the increasingly widespread use of available vaccine, especially given that there's a lack of studies and such a rapid deployment of vaccine without, a lot of study. So yeah, I want to give that to you first.
Yeah, no, thank you very much for that question. That's actually perfect for me because honestly, of this group, I'm probably the most doubting Thomas. I was very wary of big pharma before the pandemic. And now I've sort of done a 180 where I've seen that this collaboration between, the government, public and private entities, actually, especially in the US's success story of developing vaccines, actually had to start with big pharma and government collaborating. But when it comes to the side effects, when I was in medical school, one of the mentors told us, don't be the first on your block to prescribe a new medication and don't be the last to stop an old medication. And so you almost never want to be the first one to prescribe a new medicine because you want to see what the long-term side effects are if possible. I would say, though, that in the scale of what the vaccines have done in terms of both the rollout and how many people in at least in countries that have been lucky to get it have gotten it, the side effects are extremely, extremely rare. And so, of course, we know about the main four, which are anaphylaxis, a clotting disorder called, thrombosis with thrombocytopenia syndrome. Now with the younger ages getting vaccinated with myocarditis and pericarditis, and then extremely rare but death. We know about those four side effects, and certainly we have to respect, that we don't know the long-term side effects of like years down the line, what's going to happen. But in all these four cases, anaphylaxis is like 2 per million. And for the thrombosis with cytopenia syndrome, and that's seen mostly after Johnson & Johnson. That's actually only so far 36 confirmed reports out of about, I think it's 11 million doses that have been given. And now we're learning more about the pericarditis and myocarditis. So I totally respect the participant's question, but I think we know that we're very lucky, as Dr. Lawler says, to have such effective vaccines that are so safe on the population scale. And I think long-term side effects, it's true, we'll have to look very much down the line, but if you've heard about cases in the past of other maybe medications and side effects, and looking at how many millions of people had to be treated before those side effects became significant, I think we have a pretty good track record. And compared to other vaccinations such as flu, we're so lucky that we have, at least in the US, 3 very safe and very effective vaccines. And that gives us the ability to actually maybe eventually come off of masks, maybe get back to a new normal, with not as many people vaccinated as they would have to be if we had less effective vaccines. So in the US, the modeling is, 70% of the population has to be vaccinated in order for us to reach a certain level in which we can reduce some of those non-pharmaceutical interventions, such as distancing. And although it's always good to have, ventilation and hand hygiene, but some of the PPE use could stop a little bit more after 70% of the population around you has gotten vaccinated. So I think that's thanks to having such effective vaccines. So thanks for that question. I totally agree with that person about being careful, but I believe we have really good evidence now.
Yeah. Agree with everything Dr. Kim said, and I will point out that we certainly know the consequences of unmitigated epidemic transmission of SARS-CoV-2. All you have to do is look at what's happened in India, look at what's happened in Brazil and across South America. And so there is no question in terms of the cost-benefit balance between the vaccines and allowing this pandemic to continue to spread. These are some of the safest vaccines, to be honest, in their safety profiles that we have in our armamentarium of all the vaccines we use. And we have been incredibly lucky, to be honest, that we've managed to get vaccines with such high safety and efficacy profiles.
Paul, if I could just piggyback on that, though, South Korea just reported yesterday their second case of TTS, thrombosis with thrombocytopenia syndrome. And unfortunately, yesterday's case was fatal. A man in his 30s died. And what I found striking about this case was that both the patient and also the medical providers that he first encountered, they didn't seem to know what the recommended management guidelines were. In other words, we really do need to raise awareness that yes, these vaccines are very safe, and the risk-benefit ratio, always the balance is get your vaccine. It's better than getting COVID, and it's our way out. But we also need to let people know that side effects are real. They're potentially, the potential is there, and we can't downplay them. And we need to make people aware of the symptoms, what to look out for, and what kind of medical facility you need to go to when you're having these side effects. This gentleman who passed away, yesterday, he went to just a local clinic with no real imaging capabilities, and he ended up dying of a brain hemorrhage. And he was transferred to a big hospital after 3 days. And even after transfer to the big hospital, it took them 1 week to get the diagnosis, and he died 1 day after the diagnosis. And of course, when you have cases like this is going to lead, of course, to a lot of media attention. People are going to get more scared. They're not going to want to get the vaccine, and then you have the hesitancy, and it's going to, down the line have ripple effects. So I think it's very, very important that people, the public is told very clearly, transparently, frankly, yes, side effects are possible, but what do we need to look out for, and how are we going to protect you? How are we going to make sure that even if these side effects occur, we'll do our best to make sure that you don't have a bad outcome. And this has to be, I think, in South Korea, I think this needs to be advertised more, even among medical professionals, because I think there was a delay, I think, in getting the appropriate care to this particular patient, unfortunately.
Okay, sure. We're kind of running out of time. I think there's a last question from the audience that I think will be useful to conclude. His comment is, COVID-19 brought a lot of horrible things for America. It showed hidden things that America had forgotten, that brought light, like COVID, like discrimination still, effects for minority, etc. I'm just gonna give you one, last 1 minute or even less than a minute, each of you. What are the lessons learned, and what do you want to say? The last words. You can start with Dr. Tan.
I think that the concept of one health, so that, one health, one planet. In other words, what happens in China will affect Korea, will affect the US, will affect everyone. And so when we're talking about antibiotic resistance, when we're talking about emerging pathogens, when we're talking about climate change, we have to take sort of a global One Health look at the problem and not just think about, sort of an insular approach of me, my own little community, my own country. I think a multilateral global approach to thinking about the most pressing world problems. I think that was highlighted by COVID-19, and I hope that we have sustained momentum with this sort of new philosophy, new pair of eyeglasses that we've put on in terms of looking at health issues. And this will change how we really live our lives going forward. And I think the younger generation, whenever we have a big, project or big movement, I think we should make sure that 49% of the people in a group that's in charge of the movement, that they should be less than 50 years old. I mean, we need to get the young people involved because it's going to be their future. And they are more than smart enough and capable and passionate to drive us, I think, to a healthier world.
Good. Dr. Kim, you're next. Final comment.
I totally agree that, COVID has magnified existing disparities in the US, and I think perhaps a little bit in South Korea too, but I think, I hope it's okay to paraphrase Dr. Martin Luther King Jr. on, this Juneteenth weekend, but it's lack of vaccination anywhere in the world is a threat to vaccination effectiveness everywhere. So just because one country is protected, that doesn't mean that we can rest easy, or it means that we're obligated to help out. So, thank you.
Good. Dr. Lawler, final comment?
I don't think I can improve on anything Drs. Tan and Kim said, so I won't try. I will point out maybe the last thought to take away is when we look back at this in history, I think one of the striking features will be the role of information in pandemic response, and this in many ways will be the information pandemic. One aspect is the incredible power that information has had in helping response as it did in Korea, and the beneficial use of information technology in helping to track down and contain the spread of the virus. I think the other example, unfortunately, is the lesson we've learned about the incredible power of information when it's used nefariously. And I think the dramatic underestimation that we had for the power of social media and its ability to manipulate large populations, and that, I think, unfortunately, is a lesson that's not lost on many who intend to do that in the future. That's been one of the biggest issues in the U.S. That has sabotaged our response, is the amazing force of social media in shaping perception and thought and action among the general public in terms of the pandemic. And that's not been accidental, by the way. So this hopefully will give us some pause to think about how we use those tools well, how we use them for the public good, and how we mitigate the opportunities for them to be used for malevolent purposes.
Okay, well, with that, I'm going to end the discussion. Thank you, Ms. Dr. Tan. Thank you, Dr. Kim. Thank you, Dr. Lawler. I'm going to pass my mic to Margaret now for the closing remarks.
Thank you very much to you, Paul, as well, and to the three doctors, Tan, Lawler, and Kim. It's really helpful to hear all of your different points of view and all of the lessons learned. There's still a lot more to learn, and that's also what Consul General Yoon said at the very beginning of the program. So thank you again to him, the Korea Consulate, and to Consul Kim for all of their help with this event. Thank you to our three promotional partners, Stanford Medicine Center for Asian Health Research and Education, the Korean American Community Foundation of San Francisco, and Koreatown Northgate. For our audience, Asia Society is hosting virtual programs around the world. You can find our global list of events at asiasociety.org/online. If you're not already a member of one of our 13 centers, please join us. All of these global programs are free for our members, and you can track everything that we're doing on Instagram and Twitter using the handle @AsiaSocietySF. For those joining our VIP reception, go ahead and click to the second link that was emailed to you right before this program. For those who want to learn how you can join the VIP reception in the future, reach out to us. And a big thank you to our team, Rexel Uy, Polarb Jumpasit, James Gale, and Michael Chung. Thanks also to our interns, and from all of us at the Northern California Center, stay safe.